penalty to that employer is $2,000 for the year, not just for that one, but for every single employee that he or she employs. It could be hundreds. It could be about thousands.
30. About 30.
Yeah. They get a break for 30. Yes. Well, you know, again, we just have maybe a little bit of time left, and I wanted to point out some things to you, colleagues, and I want to call this Obamacare shot and chaser. Bear with me just a little bit because I think this is interesting and cute at the same time. Obamacare has been a train wreck since its inception. March 23rd, 2010, almost 3.5 years ago, the Democrats passed it to see what's in it, and now families, taxpayers, job creators, they are paying one steep heck of a price. Between its skyrocketing cost, unsustainable and wasteful programs, and job-strangling policies, a majority of Americans disapprove of this law, and they disapprove of it today. On top of that, implementation of Obamacare has become a full-fledged disaster, as we're pointed out this evening. And some of its biggest supporters agree with us. You saw the slides where the news media, not news media publications that are considered particularly conservative. As for the president, well, he just can't seem to make up his mind. President Obama on the employer mandate. He was against it in 2009 before he was for it in 2010. After signing the mandate into law, the administration announced earlier this month it would delay the employer requirement for 1 year. When the House of Representatives acted last week to really make it constitutional, because it wasn't, he didn't have the right to do that, but when we voted to allow him to do that, the same White House issued a veto threat on the bill. The thing that he had done, that we made it legal for him to do, he's going to veto that. So the shot. We have heard concerns about the complexity of the employer mandate requirements and the need for more time to implement them effectively. We have listened to your feedback and we are taking action. The administration is announcing, July the 2nd, by the way, that it will provide an additional year before the Affordable Care Act mandatory employer mandate and insurer reporting requirements begin. The chaser. That was the bill that we passed, H.R. 2667. Employer mandate delay is unnecessary. Now, these are the words of the administration. Enacting this legislation would undermine key elements of the health law, and that was stated July the 17th by the White House veto threat. President Obama on the individual mandate, because this was the other bill that we passed last week. President Obama's repeated flip-flops on the individual mandate are well documented. He pledged support for it in 2007 on the campaign trail to a group of union workers. When his health care plan was released months later, the individual mandate was noticeably absent. He went on to attack his presidential primary opponents, think HC, for supporting the requirement, only to change his mind once again shortly thereafter. You know, I could go on, but I think we've made our point here tonight, and maybe we could yield back a little time. I'm going to yield back to my colleague, and then he'll yield back to me for closing. But, Mr. Speaker, colleagues on both sides of the aisle, we're here to get it right. You know, the politics, I've always said this, and I truly believe it, the politics will take care of itself. The people will decide. We don't need term limits. They term limit us. Let's quit worrying about the politics and let's do the policy. Let's get the policy right. And 2,700-page bill crammed down the throats of the American people will never work. It never has worked. It never will work. And that's why we're here tonight, taking pains to explain and make sure that anybody within earshot understands, colleagues, that we're sincere about this. It's not partisan. We need to get rid of this law, and we need to replace it with something that truly will affect those changes that Dr. Rowe was talking about in regard to the cost of health care and the accessibility. We didn't even talk about accessibility, really, about whether or not there'll be any doctors there to see these patients. So I'll yield back to my friend from Tennessee.
I thank the gentleman for yielding, and you can't, people ask me, are there things in the bill you like? Absolutely. I mean, you can't write a 2,700-page bill and not put some things in there that are positive. There are positive things in the bill, and we should have worked together in a bipartisan way to look at those positive things we agreed to and then things we didn't agree to. And is this objection? I think the approval rating now for the Affordable Care Act is at 35%. Is this objection just Republicans? Are just Republicans out there? Well, let me read to you just a little bit here. This came up in testimony yesterday in my subcommittee hearing. The letter was from James P. Hoffa, General President of the International Brotherhood of Teamsters, and Joseph Hansen, the International President of the United Food and Commercial Workers International Union, and Donald D. Taylor, President of Unite Here, a union representing hotel, airport, food service, gaming, and textile workers. And I quote, when you and this is to then Speaker Pelosi, now minority leader, I mean, when you and the President sought our support for the Affordable Care Act, end quotes, they began, you pledged that if we liked the health plans we have now, we could keep them. Sadly, that promise is under threat. Perverse incentives are causing nightmare scenarios. First, the law creates an incentive for employers to keep employees' work hours below 30 hours a week. Numerous employers have begun to cut workers' hours to avoid this obligation, and many of them are doing so openly. The impact is twofold. Fewer hours means less pay while also losing our current health benefits. And this is president of 3 major unions. So it's not just Republicans, Mr. Speaker and Dr. Gingrich. It's the public beginning to focus on this now, because this bill is becoming the law of the land 1 January. And I wish it had worked as smooth as it could be. It is not. And it is not because it's not doing what it promised, which was the single most important thing, and that is to cut the cost of care. If it were more affordable, more of us out there could afford to have it. With that, I yield back to my friend and colleague, Dr. Gingrich.
Mr. Speaker, I just want, in closing, thank all of the members of the House GOP Doctors Caucus who participated tonight. If I tried to add up the number of years of clinical experience in our group of about 21 members of the Republican side of the aisle in this caucus, it would probably be 600+ years. So we really do know of what we speak. We don't have every answer, but we know of what we speak, and we want to get it right. And that's what this is all about. And with that, Mr. Speaker, I yield back the balance of our time.
The gentleman from Georgia yields back. Under the Speaker's announced policy of January 3, 2013, the gentleman from Wisconsin, Mr. Pokin, is recognized for 60 minutes as the designee of the Minority Leader.
Thank you, Mr. Speaker. I am proud to rise on behalf of the Congressional Progressive Caucus. And tonight, the Congressional Progressive Caucus would like to talk about voting rights and how important that is to this country and to every single person in our country. Last week, both the Senate and House Judiciary Committees have held hearings on the Voting Rights Act and what steps we need to take forward to protect the right to vote in this country. There's potentially no right that is more important, no issue that is more important to this country that we should consider than our right to vote. It should be our most fundamental right. It's the right that preserves all other liberties that Americans hold dear. When aspiring Americans take the citizenship test, they're asked, what is the most important right granted to U.S. citizens? And the correct answer? The right to vote. Protecting our rights should be the primary concern of our democracy. So you'd think that if the question asked what our most important right is, and the answer is the right to vote, would be something that's in enshrined in our U.S. Constitution, you would think that there is explicitly a right to vote. I certainly thought that. But you'd be wrong. It's startling to think at first, and it seems against everything you think you've been taught and against the principles that our country has been built on. But within our Constitution, there is no explicit right to vote. Now, we have to remember, when our Constitution was originally ratified, the right to vote was specifically not guaranteed. In fact, it was an incredibly restrictive law. Only white, male property owners above the age of 21 could vote. That was less than 20% of the country's population at the time. Many of our founders specifically did not want to expand the franchise of voting, believing most in society were unqualified for the privilege. In fact, John Adams famously wrote, and I'll quote, "It is dangerous to open so fruitful a source of controversy and altercation as would be opened by attempting to alter the qualifications of voters. There will be no end of it," unquote. Mr. Speaker, since that time, our nation's attitudes towards voting has changed slowly but very progressively. But the fact that we have needed constitutional amendments prohibiting discrimination based on race, gender, and age demonstrates that we possess no guaranteed right to vote in our Constitution. Meanwhile, these accomplishments have oftentimes been accompanied by a myriad of tactics, laws, and strategies meant to suppress the vote. Literacy tests, poll taxes, grandfather clauses, voter intimidation. These targets of discriminatory efforts have changed as well. Our first literacy tests were adopted to keep Irish Catholic immigrants from voting. Then we saw a wide array of efforts to stop African Americans from going to the polls. Now today, the bills introduced to restrict the right to vote may be a little less obvious, and lawmakers wish to suppress are a little harder to define, but these efforts are nonetheless discriminatory. We have seen burdensome regulations, requirements, and reduced early voting opportunities, which are often critical for low-income Americans who cannot take off work on Election Day. African Americans and Latinos in particular have utilized early voting days in very high numbers. College students have been the targets of a number of efforts to decrease their participation, from disallowing student IDs as an acceptable form of voter identification, to stricter residency requirements, to limited polling locations on campuses. Voter IDs and burdensome registration requirements had often made it harder for senior citizens also to be able to vote. In Wisconsin, when we've had these issues before us, many citizens no longer carry that driver's license because they no longer drive. And yet that's one of the very things that they may need to go vote with a photo ID. I myself didn't realize the full extent of the attack on our right to vote until voter ID laws were actually introduced in my home state of Wisconsin. As is often the case with voter ID laws, Republicans justified the photo ID requirement as a way to counter voter fraud in our state. Well, Mr. Speaker, the fact of the matter is this crisis of voter fraud is a fraud in and of itself. As the Brennan Center for Justice points out, you are more likely to be killed by lightning than you are to commit voter fraud in your lifetime. To be killed by lightning is more common than voter fraud in this country. Now, in Wisconsin, we're very proud. We're one of the top 3 states for voter participation: Maine, Minnesota, and Wisconsin. And we're known for our clean and effective elections. Our chief election officer found that since the year 2000 in statewide elections, the state has seen about 20 instances of voter fraud out of more than 6 million votes cast. I mean, most of those instances of voter fraud involved felons who are ineligible to vote but voted, a problem that doesn't get fixed by a photo ID. So why did the Wisconsin legislature believe we needed to combat against voter fraud? What does it mean when you have a cure in search of a disease? Well, in my experience, there's usually an ulterior motive. And in the case of restrictive voting laws, the design is to suppress the vote, to encourage lower voter turnout in the hopes of influencing elections. In other words, it's about elected officials trying to pick their voters rather than the voters picking their elected officials. Now, in Wisconsin, we're very fortunate because our state constitution specifically guarantees the right to vote. And because of this provision, the suppressive voting laws that have been introduced in our state have largely been blocked by the courts. But what I didn't realize is that while Wisconsin had a strong amendment that protected our right to vote, our U.S. Constitution does not. Unfortunately, without a guaranteed federal right to vote, you'll continue to see the types of disenfranchising efforts that have been a plague on our modern society. Mr. Speaker, that takes us to today, in last month's Supreme Court decision that struck down Section 4 of the Voting Rights Act. Section 4 was the Act's pre-clearance formula, the formula that determined which states and counties needed to get federal approval before they make voting law changes. The court ruled that the formula was outdated and thus unconstitutional. Now, I think the court may have forgot that when we reauthorized the Voting Rights Act, overwhelmingly, just in 2006, we had 390 supporters in the House of Representatives and a unanimous 98-0 vote in the Senate. Clearly, there was strong support in the legislative body for the Voting Rights Act that was now turned aside by the Supreme Court. Either way, what we know for certain is that before the ink was even dry on the Supreme Court decision, state legislatures began to act. Of the 9 states that were fully covered by the Voting Rights Act, 6 have already started to move on legislation that would restrict the right to vote. Let me just read you a couple quotes from a couple of these states. Texas, this was really quick. This is the headline. That was quick. Texas moves forward with voter ID law after Supreme Court ruling. That's from the National Journal on June 25th. The Texas law requires voters to show photo identification to vote, a measure that was blocked by the Justice Department, arguing the law would discriminate against racial minorities. At the time, Attorney General Eric Holder called the law a poll tax. And that's where Texas went as soon as that Supreme Court decision happened. In Mississippi, the headline, Mississippi Secretary of State moves to enforce new voter ID law. Their new voter ID law may seem innocuous, but more than 1 out of 10 of every eligible voters do not have a government-issued ID, clearly making it harder for people to vote in the state of Mississippi. Finally, just another example is in the state of North Carolina. The headline, Senate Republicans unveil stricter North Carolina voter ID bill. Again, according to the article from the Charlotte Observer, Republican lawmakers are emboldened in their effort to push a photo identification requirement for in-person voting after the U.S. Supreme Court struck down a key part of the 1965 Voting Rights Act. The ruling means the bill would no longer need Justice Department approval before it becomes law. So we're seeing in state after state after state that was protected by the Voter Rights Act that states now are trying to change those laws and make it harder for people to have that ability to go out and vote. Now, I happen to agree with the court that the formula was outdated. As I previously detailed, it doesn't reflect the current attempts to restrict the right to vote. In fact, it underestimates them. Let's look at it this way. Under the Voting Rights Act, 9 entire states and certain counties and 6 others were covered. But just this year, already, more than 80 restrictive voting laws in 31 states have been introduced. And given my experience in Wisconsin and what I'm seeing in states across the country, I knew that we had to take action at the national level. So I got together with Congressman Keith Ellison from Minnesota, and we worked with Fair Vote to work on a right-to-vote amendment to the U.S. Constitution that would guarantee an affirmative right to vote for every single American. Our amendment is as simple as it is necessary. It says that every American citizen possesses the fundamental right to vote in any public election where they reside, and Congress has the power to protect this right. This amendment would create an important change from current policy. No more would Americans have to prove that their right to vote has been infringed. If you live in a state right now you have to prove that that state, in changing voting laws, has somehow infringed your ability to vote in order to have a success. Instead, under our constitutional amendment, the burden of proof would go to the states, and the states would have to demonstrate that any new law they have put in place would not burden any of their citizens' ability to have a right to vote. Now, our vote is the great equalizer in this country. My brother and I have one thing in common with the Koch brothers. We each come with one single vote. The average person in the world, you may not have billions of dollars like Sheldon Adelson, but the one thing you have in common, that you have in common with Sheldon Adelson, is that you each have one single vote. Now, I understand that ratifying the Constitution is not an easy task, but on this measure, it's a deeply important one. We can and we must build the grassroots movement needed to ensure our most fundamental right is not subject to the partisan whims of state legislatures. I am holding in my hand pages and pages of people across the country who support a national right-to-vote constitutional amendment. Over 28,000 people have signed petitions that are circulated by U.S. Action and PCCC, Bold Progressives, that have got signatures saying we need to make our Constitution work for every single American, that every single person has that right to vote. And this is 28,000 names right here of people who support this most fundamental right. Mr. Speaker, at the end of the day, the right to vote is not a Republican right or a Democratic right. It's an American right. And the recent voting rights decision demonstrates anything. It's that we need to do everything we can to help protect that right. Mr. Speaker, with that, I would like to yield back the remainder of my time, but I would like to reinforce the Congressional Progressive Caucus is going to do everything that we can to make sure that every American has a right to vote, and that a right to vote amendment to the U.S. Constitution is the most sure, most effective way to get that done. So, Mr. Speaker, with that, I would like to yield back the remainder of my time.
The gentleman from Wisconsin yields back. Under the Speaker's announced policy of January 3, 2013, the Chair recognizes the gentleman from Georgia, Mr. Collins, for 30 minutes.
Thank you, Mr. Speaker. I appreciate that. Well, it's good to be here at the end of a day in which there's been a lot of excitement here on the floor, a lot of voting going on, a lot of debate, which is what we're up here for. And one of the things that I have committed to, as we talked about a little bit last week, is pointing out some things that may fall under a little bit under the radar, but actually matter a great deal to the people of not only the 9th District, but to the people of the United States. And up here, we can get many times lost in what I'll call the big picture items, or the latest of what's hot, so to speak. And tonight I want to talk about our local pharmacists. For me, that is, I have a little pharmacist I go to. We have several, but one of the main ones I go to is Woody's Pharmacy, Kevin Woody. And I go in there and I know that when I ask him about the drugs for myself, for my wife, my kids, he gives me answers, he helps me, know how they interact, what goes on. And we got pharmacists in all kinds of settings that do that every day for folks. But our local pharmacies, and especially our community pharmacies, are right now under attack. And I want to talk tonight, and I'm going to be joined hopefully here in a little bit with the gentleman from Pennsylvania to talk about the challenges facing independent and community pharmacies. You see, local pharmacists play a vital role in America's neighborhoods and communities, particularly in more rural areas of northeast Georgia. They provide unparalleled guidance and assistance and resources for families, including my own. I'm committed to protecting access to independent and community pharmacists and helping to level the playing field through an effective and robust oversight of the pharmacy benefit managers, or PBMs. It's a tough enough task to survive in this economy, and the overregulation by the administration is only making it more difficult. I'm committed to working with my colleagues, particularly the gentleman from Pennsylvania, to promote legislation that would provide consumers with greater choice of pharmacies, require fair standards for PBM pharmacies, support access to diabetes testing supplies, protect traditional pharmacy compounding, and ensure that our military families can enjoy the many benefits that community pharmacies provide. In many cases, independent and community pharmacists have dedicated their career to providing quality patient care. However, they have been continuously cut by unfair reimbursements, overbearing audits, and a take-it-or-leave-it approach to contracts. Over the next 30 minutes, I look forward to discussing the challenges facing independent and community pharmacists and the important role they play in the lives of many of our constituents. Although we cannot sufficiently cover these issues in the next half hour, I hope this will be the first of many conversations on this floor about an important topic. And this is what I mean about ideas and topics that may not bring the headlines, they may not bring the stories on the opening of the evening news, but they affect us daily in our lives, and they're often overlooked. When we deal many times on this floor, and I've spoken of it before, is how do we deal with and what's the cost of regulation and how they are affecting our everyday lives. This is one of the areas, especially with our community pharmacists, that are affecting right now. It's affecting how they do business. And as one community pharmacist told me recently, that if something doesn't change soon, that in my area of northeast Georgia, which has a vibrant community pharmacy along with PBM pharmacies and others, that within 10 years there may not be a community pharmacist left in northeast Georgia. And that's a scary thought, Mr. Speaker. When you think about that for a second, when you look at an industry that many of us grow up, you know, and you can have stories on going back to when many pharmacists had soda stands, and they had, you know, it was just a full-service place where you could go, and even my pharmacist today still has the scoops of ice cream. One of the ways my kids want to come with me to the store is they say, I'll go with you if you're going to Woody's because I want a scoop of ice cream. So it's just it's a family place. It's something that I think brings back a sense of Americana, but it also hits at the very idea of what we'll just take as just good old-fashioned entrepreneurship, businesses that mean something to our community, but also provide a service that is invaluable. And right now I think those are under attack, and those are the things that just concern me. And when we look at that possibility of our, as the pharmacist told me, he said that there possibly may not even be community pharmacists in our area within the next 10 years. That really struck my attention, and it's made me, before I was even elected, begin to look at what are the problems and how can we address those as we go along. I can give examples, and I bet almost every member here on both sides of the aisle could come in and talk about their pharmacist wherever they may work, but a community pharmacist who they can call on and ask about. And my parents, as they have, I've watched them grow up and they get older. We have questions about their medicines. I know that I can call my pharmacist and ask him questions. I know that many of you, and maybe even you, Mr. Speaker, have that person that you can talk about for the drugs and the issues that just keep us healthy. And one of the things that they also help us do, and community pharmacists do, is provide that preventative care that keeps us from getting into these long-term illnesses which drive up the health care costs, which is talked about so much on this House floor. And really, from my perspective, the tragedy of Obamacare is, let's get back to the very roots of medicine. And as the doctors were speaking earlier tonight on the floor, it's talking about how we can do preventive medicine and make sure that our health of our constituents are taken care of. Community pharmacists do just that. One of the first challenges facing our local pharmacists I want to discuss here tonight relates to diabetic testing supplies and the competitive bidding process. Earlier this year, I wrote the Comptroller General, Gene Dodoro, and expressing concern about the impact that Medicare competitive bidding process will have on patients' access to diabetic testing supplies. Seniors in northeast Georgia and across the state rely on their ability to get the testing supplies from their local pharmacists, and many have written to me expressing their concerns that applying competitive bidding pricing to independent community pharmacists could negatively impact their access to these essential supplies. In more rural communities, such as northeast Georgia, an independent community pharmacy may be the only available option for seniors. Their local pharmacist helps them properly use their test strips and meters and provides much-needed resource and guidance in managing their disease. A 72% reduction in reimbursement for retail pharmacies that are currently supplying these items to Medicare beneficiaries was announced on January 30, 2013. This is a reduction in the reimbursement took effect on July 1 of this year. Here's some of the feedback that Georgians have given about the impact that this reimbursement reduction is having on their quality of life and access to care. We've heard things like, I've had difficulty finding a new provider. My product of choice was unavailable. I've been forced to change providers. The quality of my care and service is poor. My costs have increased. I've experienced poor communications from CMS. I'm confused about the changes. Independent and community pharmacists typically sell diabetic testing supplies to provide a service to patients, not to make money. Even before the reduction in reimbursement rates, the profit margins on these supplies were very low. Now pharmacists have to choose between keeping their business open or giving their patients the supplies and care they need. This isn't a choice they should be forced to make. In an area and a time in which our economy and jobs are suffering, this is another example of a business that is fighting against the world, so to speak, to stay in business and to employ those 3 or 4 or 5 or up to 10 or 15 people that take care of the people in our communities, Mr. Speaker. This is something we need to take care of. This is something, when you hear the feedback from folks who are calling our office and writing our office and calling their pharmacist and saying, I'm having difficulty finding a new provider. I can't make sense of this. I'm forced to change my provider. And there's quality and service are poor. We need to take a look at what's going on. Another pressing issue for my local pharmacists is the lack of oversight and transparency when it comes to the pharmacy benefit managers. PBMs are actually one of the least regulated segments of the healthcare market, yet they are the cause of numerous frivolous audits that local pharmacies are subjected to. Now, supporting strong PBM transparency requirements is key to delivering real savings to patients. Unlike my local pharmacists and those across the nation, PBMs do not have a real relationship with patients. In fact, it is not uncommon for them to secretly retain from most manufacturers' payments, i.e. rebates, discounts, and other fees, instead of passing the savings on to patients. Additionally, PBMs have been known to switch plan members from low to high-cost drugs and manipulate generic pricing. At the end of the day, the data points to the fact that PBM market is broken. I can speak to this from my own personal experience. As I've shared before, I believe from when we talk about problems, we need to relate it to what people can understand. And for this, I can understand it through my family, but also through my parents, who have talked about how their drugs have been changed, or they've been given short notice of changes, or when they get to from their doctor who gives them the prescription to take them to their pharmacy, they have a problem because they're not going to be certified because there's been a change just in the last little bit in what drug the coverage will make, and the PBMs have had a large part in that. You see, what I believe is their conduct is anti-competitive and anti-consumer, and independent community pharmacists are often left vulnerable to their market power. But there are solutions to this problem. For example, allowing the smaller to collectively negotiate will help level the playing field. The threat of antitrust liability and the status quo prevents these collective negotiations, and I believe an antitrust exemption is appropriate and consistent with past exemptions enacted by this Congress. It is with that I am proud to be an original co-sponsor of what was known as the Protecting Our Hometown Independent Pharmacies Act of 2013, which I believe achieves this goal. You know, the author of this bill, Mr. Marino, and I have had several conversations discussing his examples and what brought him into an understanding of what is going on with our community pharmacists and the problems that are developed here. And I want to applaud, and one of the things I want to do is take out and highlight members who have brought forward pieces of legislation that I believe matter to our constituents, and they matter to the American people. This is a conservative piece of legislation that brings forward and highlights a problem with our community pharmacists who are reliable businessmen in their communities, and by doing so and taking that part, Mr. Marino has helped bring forth a piece of legislation that I'm glad to support and look forward to moving forward, hopefully through the committee process and onto this floor and eventually signed into law. Now understand, there's a lot of discussion that needs to be had here, and PBMs take their fair share of blame, and there's a lot of problems in this situation. And it is something we need to discuss because it matters to the people back home. It matters to those very essence of health and health care, which we come down to this well and we talk about all the time. We talk about cost. We talk about the problems with access. This is an area where I believe we can continue to move forward. You see, there's also another pressing matter facing independent community pharmacists, particularly in Northeast Georgia, and that is abusive audit tactics. I believe, like many Americans, that pharmacy audits should be focused on uncovering actual fraud and abuse. Audits play an important role in ensuring high-quality patient care and services. Unfortunately, PBMs are leveraging their power to abuse the auditing process. They're singling out expensive drugs and using typographical and other trivial areas to recoup from pharmacies significant amounts of money, not to return to Medicare, but to line their own pockets. Now, this is where I'm going to use an example that I had a few months ago. I had a number of pharmacists from their local, my local pharmacists all over Northeast Georgia come in, and they met with me. And all I did was I sent out a note because I'd been hearing about this from my local pharmacists and from others, and I said, come talk to me about what you're experiencing. And like a lot of times, and Ms. Speaker, maybe you've done a similar thing with businesses. You expect maybe 3 or 4 people to show up. In my conference room, I had a full house. Pharmacists who left and drove some as many as 2 hours to come to that office to sit down and talk about the problems that they were facing. What that told me in the middle of the day is that the issues and the problems that they have were more important to them than spending time that morning and finding somebody to cover their shop so they could come talk about this, because it's affecting the very quality of their existence. Now, as we look at this, they began to give me examples. For example, let's say your local pharmacist fills a $500 prescription for you that you called in over the phone, or you had called in from the doctor's office. The pharmacist dispensed the correct drug in the correct amount and provided you the correct directions for taking the drug. Ms. Speaker, do we have a problem at this point? I don't think so. You're getting the right drug in the right amount, in the right container, with the right label. Everything's there on what your doctor had wanted you to have. But if the pharmacist makes a mistake in his personal records and his checking off, instead of checking the called in over the phone box, he checks the faxed in box, a PBM could then, during their audit of the pharmacy, find the mistake and then take back the entire $500, not just the copay and not just the profit the pharmacy received. They take back the entire cost of the drug. Now, I've said before, there are a lot of things that make me scratch my head. This is one of them. It's one thing to come in and be audited, and it's one thing to find a mistake in which there's a clerical error. And there needs to be some correction to that clerical error. But let me go back, Mr. Speaker, and remind you that it was dispensed properly in the correct amount, with the correct drug, in the correct facility, with the correct directions on there. But however, on the paperwork, on how the call came in, how they took the prescription down, they were audited and dinged for that, and they were not just dinged for the amount of their copay or their profit even. They were dinged for the entire amount of the drug. What's really interesting about this is I've also had several of my pharmacists say it is really interesting to them that when they're audited, it's not the generics that are audited. It is the brand names that seem to be audited, the higher cost drugs that find their way onto the audit list. I think that's really interesting, because what happens is if one mistake comes, you're talking about a major cost for these pharmacists. And this is not something they can continue to eat. Now, it can be said they can appeal it and they can go through the process, but it is something over and over. They don't get to appeal it and hold the money. They have to send the money in and then appeal. Now, does that sound fair? I don't think so. I think what we've got to do here is begin to look at this problem in its entirety. The PBM could pocket the entire cost of a correctly dispensed drug, even what the pharmacy paid wholesale. This leaves me baffled. Obviously, auditing measures should be in place, but for transparency and accountability, not to financially penalize one's competitors. Oh, by the way, some of the PBMs are actually involved in the competitors to the local pharmacies in which they audit. Just a small reminder. You know, I could stand here all evening and tell you story after story of the unfair and almost unbelievable auditing practice that my local independent folks have had to deal with. One local pharmacist told me about how they had already been audited 3 times that year and they were preparing their 4th. Mr. Speaker, you know when he told me that? March. He had been audited 3 times, getting ready for a 4th, and it was January, February, March. This seems to be a problem. Interesting enough, the audits don't focus, as I've already said, on generic drugs. The audits typically look at administrative errors on high-priced drugs. This comes as no surprise. We know that the PBMs are looking to take money, line their pockets, and not care for patients. They don't sponsor baseball teams, they don't participate in chili cook-offs, and they sure aren't going to any tomato festivals. Patient care takes a back seat to profit margins. I believe that Congress should take a closer look at PBMs because in the status quo, after a pharmacy has been audited, recoupment funds go back to the PBM. This is unacceptable. In other words, you're auditing and the fines that you get, the penalties that you get go to you. Again, there seems to be an incentive problem here. You're dealing with the high-cost drugs. You're missing the generics. You're looking for clerical errors on correctly dispensed drugs. The patient never had a problem, but yet the pharmacist was dinged. You know, I'm committed to working with my colleagues to make sure that Medicare is getting its fair share of funds back. There is one word we hear a great deal on this floor. No matter the debate topic, it is bound to come up at least once, and that word is transparency. But there are a few areas in which this concept is more important. You see, transparency saves money and helps markets work better. It helps it work as it was intended to work. Transparency allows plans and payers, including large corporations and governments, to confirm that a PBM is in fact providing the service it was hired to do, to secure low drug cost. Now remember, in this world of regulation, and for those who know me in my short time up here in Washington, this is one of the issues that I have focused like a laser on, in regulation. In fact, tomorrow morning I encourage members, if they're not busy with them, they want to come to a regulatory reform caucus breakfast, come see us. We'll have breakfast there for them, and we're going to discuss the effects of regulatory reform and why this matters. Many times we in elected office, we talk about regulatory reform and why it matters, and it's going to make sense. I believe tonight we've shown how it affects local community pharmacists, and that's something that needs to be looked at. But again, what was the PBM supposed to do? They were supposed to secure low drug costs. They were supposed to secure a better way for our Medicare savings. This is not what's happening. Unfortunately, under today's policies, a plan's sponsor has no way to verify that their PBM is sharing manufacturer rebates or that the PBM is negotiating the lowest possible cost for specific drugs. In fact, recent data indicates the exact opposite is occurring. For example, TRICARE anticipates savings of $1.67 billion by negotiating its own drug prices and rebates for its 9 million beneficiaries rather than going through a PBM. Let me state that one more time, Mr. Speaker. TRICARE anticipates saving $1.67 billion by negotiating its own drug prices and rebates for its 9 million beneficiaries rather than going through a PBM. I happen to be on this floor for the last couple of days and in that chair listening to discussions on our DOD appropriations and the struggles that we're having with our funding for our vital services at our defenses. Don't you think that this is something that we can forward not only in defense but in other areas as well? I believe it is. The state of Texas estimates they could save $265 million by switching to a transparent PBM contract. This is no chump change we're talking about here tonight. Although my time draws to a close, I'm pleased that the conversations are just beginning. The challenges facing independent and community pharmacies are great, but the important role they play in our towns and states are even greater. It is coming to a time in a place like this in which we can look forward to solutions that matter. I did not come to Washington, D.C. simply to watch things happen and to wonder why. I came to be a part of a solution. Like you, Mr. Speaker, we're part of a freshman class that came here believing, as I've said before, that this is a place that people still look for to make this country continually the greatest country on earth, that people look for us for solutions and answers. And the way they do that is looking at common sense legislation. They look at common sense solutions that affect them every day. For many, many people in this country, and especially in my home of Northeast Georgia, local pharmacies are a place that sponsor those football teams and baseball teams. They're the places where senior citizens come. And as I've watched many times at the pharmacies that I go to, whether it be my own pharmacy or not, it is the pharmacies that where I watched just the other day, I went in and a sweet little senior citizen lady, I pastored for 11 years. My first church, I actually had 45 senior adults, was my first church. That was all that was there. I was 28 years old, and all of a sudden, I gained all these grandparents. So for me, it was something that I learned a great deal from. But when I watched this sweet little lady come up to the counter, She asked Kevin about some issues that she was having with her drugs, and she was trying to figure out what was going on. And Kevin took the time to talk with her and explain, no, this is not what's really happening. This is what you need to do, and this is the medicine you need to take. And he took the time to care. Pharmacists all across this country, and I want to make this very clear, this has nothing to do with pharmacists individually. Pharmacists, whether they work in large shops or small shops, community stores to large box stores, are wonderfully dedicated professionals who do a wonderful job. When they, excuse me, they work hard at helping their customers. They work hard at helping those that have come in between. And when we deal in this kind of environment, we make sure that our local pharmacies are the ones that can have a chance to continue to grow and to prosper in their communities. When we have our community pharmacies operating as they should, then we're going to be able to continue the process of making sure that our communities have the pharmacies that they can depend on, and also a transparency that comes with dealing with these PBMs and with the auditing practices which have been really tearing apart our pharmacies and community pharmacies as a whole. I go back to that one statement that my local pharmacist said to me as he was sitting there and he was looking across and he was explaining what I've talked about here tonight about the auditing practices, when he said that if this doesn't change, our pharmacists will be out of business. There won't be any pharmacies left in the community world. For Northeast Georgia, that would be a tragedy. I'm pleased tonight to also see my good friend from Pennsylvania, Mr. Marino, who has been a real leader in this area. I'm a proud co-sponsor of his legislation protecting Hometown Independent Pharmacies Act of 2013, and would love to yield to him now to share further on what we've experienced during this time.
Well, thank you. Mr. Speaker, today independent pharmacists are facing an increasing number of challenges that threaten their very livelihood. These are the independent mom and pop pharmacies that all Americans have come to know and to love. They are the neighborhood staple that you have come to rely on. They are where you can go for basic medical advice, and they are where new parents can have their child's prescriptions filled. On average, independent pharmacies fill over 200 prescriptions every day, provide immunization, durable medical equipment, diabetes training, and other vital services. Unfortunately, these independent pharmacies are more vulnerable than ever and are having to lay off workers at an alarming rate. As more independent pharmacies are forced to close their doors, I am increasingly concerned about the impact that this will have on American families, especially those in rural areas like my district in northeast Pennsylvania. Not only does their closure jeopardize the local drug supply, but it also has dangerous consequences for the surrounding area's medical providers. That's right, dangerous consequences for the surrounding area's medical providers. One of the biggest dangers to local independent pharmacies is the pharmacy benefit managers industry, or PBMs. Over the past few years, PBM's power has become concentrated into the hands of a few, enabling them to dominate over their competition. Independent pharmacies are at a competitive disadvantage that prevents them from providing their customers with vital prescriptions at a reasonable cost. I have heard from a number of pharmacists that PBMs have an incredible market power over independent pharmacists. Even worse, the political power of only a handful of companies has enabled them to grow and swallow their competition, which is only expected to intensify if Obamacare is fully implemented. This is why I, along with my colleague to my right and Judy Chu of California, introduced H.R. 1188, the Preserving Our Hometown Independent Pharmacies Act of 2013. This bipartisan common sense legislation provides a limited exemption for independent community pharmacists from antitrust laws. My bill would level the playing field by enabling the mom and pop pharmacies to work together in order to negotiate better contract terms from the large drug companies and pharmacy benefit managers, or PBMs. The unchecked practice of PBMs have gone on for too long, and it's time we pass H.R. 1188 to stop these harmful practices. And I yield back. Thank you.
Well, I appreciate that. As our time draws to a close tonight, I'm pleased that we can begin these conversations. That's what I want to have with the American people, with our body here, bringing out and highlighting legislation and the work that I believe is being done here, because I believe there is great things that can happen when we pull together and we find the things that matter to Main Street. And when we do that, Congressman Marino and others, as we pull forward like this, are actually bringing ideas to the forefront that help and build our economy, talk about those jobs, keep those jobs in the community, and provide a great public service. When we're looking at a health care situation and an aging population, our community pharmacists need to be a vital player in that market, making sure that our health and our well-being are taken care of in a kind and caring and compassionate way. The challenges facing independent community pharmacists are great, but the important role they play in our towns and states is even greater still. And I want to thank the gentleman from Pennsylvania for his leadership. I want to thank him for joining me here tonight and being a part of discussing real solutions and real answers of why a conservative agenda is important to America, because it matters to the Main Street, it matters to real people on everyday life situations. And with that, I yield back, Mr. Speaker.
The gentleman representing Dawsonville, Georgia, yields back. Under the Speaker's announced policy of January 3, 2013, the Chair recognizes the gentlelady from Minnesota, Mrs. Bachmann, for 30 minutes.
Mr. Speaker, thank you, and thank you to the Constitution, the Declaration of Independence, and to the rules of this body that allow for members to come down to this well in the most important place where free speech is allowed, and I'm extremely grateful for that opportunity to be here tonight. And one subject that I would like to focus on this evening is the issue that is being taken up here in Washington, D.C. It's gotten some attention in recent weeks, certainly with a bill that came through the United States Senate, and that was a bill that granted amnesty to illegal aliens. That bill passed through the United States Senate. Unfortunately, that bill does nothing about the main problem that we deal with in immigration, and that's border security. 27 years ago, Ronald Reagan made a deal with the American people, Mr. Speaker. He said this. He said, we're going to have a one-time deal. We're going to deal with immigration right now. It kind of sounds like very familiar rhetoric that we're getting today. We're going to deal with this issue once and for all. We're going to take this issue off the table. And then President Reagan said, we're going to grant amnesty. We're going to secure the borders, he said. We're going to make that happen. But we're also going to grant amnesty to the illegal aliens that are here in the United States. He estimated about 1 million illegal aliens would be here in the United States. Once the bill was passed, the American people found out it wasn't 1 million illegal aliens. It was 3.6 million illegal aliens that were granted amnesty status. Once that amnesty status was granted, the United States had a policy of dealing with chain migration, and pretty soon that turned into 15 million foreigners or illegal aliens who were allowed to come into the United States as immigrants. Now, we're all immigrants. I'm an immigrant. Mr. Speaker, I imagine you're an immigrant. All of us are descended from immigrants. This is a good thing. We're not here bashing immigrants. If we didn't have immigrants, we wouldn't have a country. We love immigrants. But what we do love also is the rule of law. We believe in the rule of law. That's what this chamber is. In fact, this chamber, Mr. Speaker, is surrounded. There are medallions above every door in this chamber. And those medallions have the faces of lawmakers over the time of recorded human history. And each one of these is a silhouette. And they contributed to the rule of law by adding to the certainty for mankind, for good rules and a good society that we can live under. And in this chamber, many of the American people may not know that our motto, "In God We Trust," is written above the stand, Mr. Speaker, where you're standing today, just above the American flag. And just opposite from "In God We Trust" is a lawmaker. unique among all of the lawmakers in this chamber. That lawmaker is Moses. Moses faces the Speaker, and you'll note, Mr. Speaker, that Moses is the only lawmaker that has a full face. And why would that be? Why would Moses be given a status different than all of the other lawmakers in this chamber? Mr. Speaker, I believe it's for this reason. I believe it is because the great English jurist Blackstone, who was the mentor to the founders of this nation, Blackstone wrote that English common law and all of law in England is based upon the foundation bedrock of the Ten Commandments as given through Moses. And Moses is the full face, the most important lawgiver, because all of the law you see, of all of the subsequent lawmakers down throughout the recorded annals of human history rest on the foundation of law and the rule of law as given by Moses and given by God, according to Holy Torah and to the Bible, to Moses, and all of law descends from there. Why that history lesson? Why that lesson on talking about law and the lawgiver while we're in the middle of talking about immigration? Because right now, Mr. Speaker, the Senate bill and also the proposed House bill, so-called the DREAM Act, is premised upon the condition that people who came into the United States by breaking the law would receive an unparalleled benefit, much more so than the benefit of those who come into America legally. How many people come into America legally every year? Well, it's shocking. People think we're not allowing people in. 1 million people a year, Mr. Speaker, are allowed into the United States legally. They go through the process and they become American citizens, and we applaud, and I have been to naturalization ceremonies proudly welcoming individuals in. Today I was in a cab just before I came over here. A man from Pakistan was thrilled to be an American citizen. I shook his hand. I said, I'm so grateful that you're here, and I'm grateful that you came into our nation legally. I'm grateful. Welcome. We're happy you're here. I married a family of immigrants. My in-laws came here through the legal process. Why is this important? It's important because we, as a nation of laws, must observe those laws. And now we're looking at changing that status by rewarding people who broke laws and putting them in the head of the line in front of people who stood by the law and did everything they could to follow the law to become legal citizens. If you look at every nation in the world and their immigration policy, and if you look at the numbers of people of every single nation of the world, and remember, Mr. Speaker, the United States is not the most populated country. There are more people in China than there are in the United States, and yet the United States is such a generous group of people. We allow more legal immigration in 1 year than the rest of the world, every country of the world combined. We allow more legal immigrants, 1 million people a year, and yet we still have 4 million people on a waiting list doing everything right, trying to come into the country legally. So why, I ask, Mr. Speaker, would we put to the front of the line lawbreakers, people who decided we're not going to pay attention to the law, to the lawgivers of history, to Moses who gave the original 10 Commandments. We're going to break this law in this body where law is made. We're going to break this law, and for some reason this body would choose to benefit those who broke our laws. I say no, because the real problem with immigration, Mr. Speaker, is that we need to keep it legal and make it legal. And that's why our very first consideration and only consideration should be complete border security first. Border security for America first. Why? Because amnesty for illegal aliens is incredibly expensive. The estimate, Mr. Speaker, is $6 trillion of additional debt for our children, $6 trillion in redistribution of wealth with amnesty for illegal aliens. Nearly half of that number, Mr. Speaker, shockingly, would be for retirement benefits for illegal aliens. So while you and I and millions of Americans have been working and paying in over the decades to Social Security and to Medicare, while we've been paying in and while people who are baby boomers like myself are just about at that time to draw down on our Social Security and our Medicare benefits, now we would open the door wide. We would benefit and grant citizenship, a legal protected status, and immediate access to Social Security and Medicare, Obamacare, Medicaid, 80 different means-tested welfare programs. Why would we do this? Is it because we have an abundance of money that's overflowing from our Treasury and we have absolutely no idea what to do with it? I don't think so. Just in my brief time in Congress, we have doubled the national debt. That's one bill. Essentially full-on amnesty, perpetual amnesty with no means of deportation ever, with no border security ever. That's the fake bill that is coming out of the Senate. What is the House of Representatives looking to take up? It is a different bill. It's called the Dreamers Bill. And we're all told that what we need to do is get behind this effort to reward instant legalization status to children of illegal aliens. Well, I want to put this on the floor for the American people. The children of illegal aliens very well may make up the largest subset of illegal aliens in the United States. But we need to recognize this is fake backdoor amnesty. This isn't about feeling sorry for kids or trying to deal with people through no fault of their own or here in the United States illegally. This is what we're talking about. We're talking about millions of individuals who would be given instantaneous legal status. But it isn't just the children, Mr. Speaker. Because they would be given amnesty, they would immediately have the right to apply, and it would be granted for their parents to have legal status, legal permanent status. So we aren't just talking about millions of kids, Mr. Speaker. We're talking about all their parents, too. So take all of the kids and then double the number for their biological parents. And then if there is a waiting period, let's say 5 years, until they get their full legal status, then the parents can apply for legal status for their parents. And it goes from there. Very likely what we will see is a family reunification, chain migration, and rather than tens of millions of illegal aliens, some have estimated as much as over 100 million additional illegal aliens would be given amnesty in addition to the generosity of every year. Now, why is this important? Again, because we hate immigrants? Absolutely, 1,000% no. That's not true. Number one, the rule of law. We need to observe the law. Number two, dealing with our debt and with the costs. It costs a fortune to have illegal immigration. But here's the third reason. It's because we will never solve this problem. You see, all we will have done, Mr. Speaker, is made sure that we will increase this problem and we will have it with us forever, because we will have ongoing perpetual amnesty. And I would like to ask to join me right now my fellow colleague, Representative Steve King from Iowa, who has been essentially the leading voice on this issue in Congress, talking about making sure that we, the American people, recognize what we're going into. You see, we had the Obamacare bill. Former Speaker Nancy Pelosi said we had to read the bill to know what was in it. It's a travesty. It's bankrupting America. Also, with the so-called Dreamer Act, which, let's face it, it is 3/4 of the cost of the terrible fake border security bill in the Senate. So you've got this terrible full-on amnesty bill in the Senate. Mr. Speaker, the Dreamers bill takes you 3/4 of the way to the full-on amnesty bill. So when you take these two bills and you put them in conference committee, you can have either 100% amnesty or you could have 75% amnesty. When you split the difference on that, where are you? You got amnesty. That's the problem, Mr. Speaker. It's a fake, no border security, but it's a total, authentic, nearly 100% amnesty. And I'd like to ask Representative Steve King to speak to that now, and I yield to the gentleman. I thank you.
I thank the gentlelady from Minnesota for yielding, and I appreciate the delivery.